Now, the onus no longer on doctors to educate members of the public on diabetes prevention and management. Instead, community nurses are being trained in a 4-day workshop to fill that gap and ensure that those at risk for or living with diabetes are provided with the necessary information needed to cope with the disease. Terry Andrew tells us more.
To combat this growing epidemic, the Antigua and Barbuda Diabetes Association has partnered with the University of the West Indies in undertaking a new venture, bringing research to diabetes into global environment and services bridges, geared towards training community health aides in diabetes prevention and awareness. Day one of the workshop included district nurses from the Browns Avenue, Grace Farm and Jennings Health Centers, as well as the Bolands, Potters and Bethesda clinics. Representative of the Pan-American Health Organization, PAHO, Edward Emmanuel, reiterates the importance of trained community aides.
Community health aides play a very significant role in the community and bringing information to individuals where they live, providing care to individuals where they live, and interacting with the community. I believe that this program will achieve tremendous success, not only with this pilot group, but I would advise that as we evaluate the pilot, the success of the pilot, then it could be expanded to other communities in Antigua and Barbuda.
Emmanuel says one of 3 leading causes of death in Antigua and Barbuda is diabetes.
In 2008, the total number of deaths was 529, of which 282 were males and 247 females. In 2009, the total number of deaths recorded was 448, of which 219 were males and 229 were females. In 2008, diabetes ranked 3rd among the total number of deaths recorded, as well as in 2009.
Researcher at the Epidemiology Unit at the University of the West Indies, Shelley McFarlane, says the primary objectives of the workshop include optimizing self-management education among those at risk for and those living with diabetes and reducing the economic burden of diabetes at a societal level.
Studies have shown that if you educate someone to optimally manage their diabetes, then that they'll have less burden on the health systems because they won't be visiting as often, they won't have so many complications. So that's the whole idea of empowering persons with diabetes to self-manage.
McFarlane and members of the Antigua and Barbuda Diabetes Association are hoping that as a result of the workshop and proper education, the stigma attached to the disease would be further reduced. Terry Andrew, ABS News.